October is Breast Cancer Awareness Month, a time to educate women and remind us all to get our screenings. Now, one local breast center is opening next Saturday, the 28th, to provide an easier alternative for working and busy women. And joining us now to talk about this is Thewes, Ascension St. Vincent Breast Center Manager. Thank you so much for being with us today. Appreciate your time here today. Now, we all hear the mantra, get your mammogram, but you know, so many women I hear talk about it's so painful, so they kind of put it off. Why is this so important to, go beyond the pain and get this done?
So screening mammograms can detect breast cancer before it can be felt on a physical or self-breast exam. Right. And breast cancer is diagnosed in an early stage, have better outcomes. Right. So for early stage breast cancer, the 5-year survival rate is 99%, with individuals living long beyond that. So early detection can truly save lives with breast cancer.
And that's a mammogram for sure, right?
Yes.
All right, that's what we're talking about here. So at what age should women begin getting those yearly mammograms?
So the American College of Radiology recommends that women of average risk begin mammograms annually. So as you said, every year for women starting at the age of 40. There currently is no recommended age limit on when to stop getting mammograms, so that's something that individuals should speak with their healthcare providers about. But there are women that can have certain high-risk features that could warrant them to start mammograms at a younger age, and that includes things like having a known genetic mutation that is correlated with breast cancer. So the one example is the BRCA1 and 2 or BRCA1 and 2 gene, but can also include features like having a family member or multiple family members with certain types of cancers. So breast cancer, ovarian cancer, metastatic prostate cancer, and pancreatic cancer. Individuals that have had chest radiation therapy younger than the age of 30, and then also individuals that have had a personal history of breast cancer or history of high-risk breast lesions.
Now, some of this may be things that people don't think of right away, and so is that something they should talk to their doctor? Am I at high risk, to find out if they need to begin earlier, like 20, 25, something like that?
Absolutely. Okay. Yes, they should speak with their healthcare provider. They can help go through all of those features to see if they warrant having that at a younger age.
It seems like everyone has been touched by breast cancer, either they themselves or a family member or a friend. What is the prevalence of breast cancer in Indiana? You have some numbers for us here, right?
Yes. So in Indiana, breast cancer for females is the second diagnosed cancer.
My goodness.
And that's just after skin cancer, and it is the second leading cancer for mortality as well in Indiana. We're also starting to see aggregated data from organizations about the decrease in screening mammograms due to the COVID-19 pandemic. So when you compare 2019 screening numbers to 2020, for Indiana, it was a 5% decrease in women getting their screening mammograms. And in our southwestern Indiana and neighboring Kentucky counties, we saw anywhere from 1% to an 8% decrease in screening mammograms.
And when you're talking about the most prevalent or the second most prevalent cancer in Indiana, we don't need to see those numbers go down. People need to really listen and get their screenings done.
Absolutely.
Now, you all are offering a Saturday screening. Why have you decided to do this? And tell us, a little bit more about that.
Well, we want to make it as convenient as possible. Right. We know people are busy, so yes, we are offering appointments on a Saturday. That's next Saturday, October 28th. Appointments are available from 8 a.m. to 12 p.m. and can be scheduled by calling the Ascension St. Vincent Breast Center at 812-485-4437. We also have appointments throughout the community and tri-state area on our mobile mammography unit. It's private, privacy is ensured, it's state-of-the-art, it's the exact same equipment that we have at the breast center, so you can get that closer to home, closer to your place of employment, again, to make it more convenient.
And how do we find out where that is and to do that?
So you can call the breast center, can give you information on all that. Again, just call the Ascension St. Vincent Breast Center.
Okay, so we do need to have an appointment, though, to come on Saturday, but you're also available weekdays. You can just call in and make an appointment. Just however you do it, just get your screening done, right?
Yes.
All right. Thewes, thank you so much for joining us today to talk more about this such an important topic here. Get your mammograms, get your breast screening, and early detection is key. Thanks so much.
Thank you.